This medication is used to treat fungal skin infections such as athlete's foot, jock itch, and ringworm. It is also used to treat a skin condition known as pityriasis, tinea versicolor, a fungal infection that causes a lightening or darkening of the skin of the neck, chest, arms, or legs. Ciclopirox is an antifungal medication that works by stopping the growth of fungus. It is typically applied once or twice daily, and it is best to apply at the same time each day for the best results. When using Ciclopirox suspension, topical, it is important to apply it only on the skin. Make sure to clean and dry the affected area before applying the medication. Shake the bottle well before each use and then apply a thin layer on and around the affected area as directed by your doctor, usually twice daily. Remember to wash your hands after using unless the area being treated includes the hands. Avoid applying the medication in the eyes, nose, mouth, or inside the vagina. If the medication does come into contact with these areas, rinse with plenty of water. Using this medication regularly at the same times each day will help you get the most benefit from it. It's important to continue using the medication for the full time prescribed, even if your symptoms improve before then. Stopping the medication too early may result in the infection returning. You should start to see improvement in your condition within the first week of treatment. If your condition worsens or does not improve after 2 weeks for pityriasis and after 4 weeks for other fungal skin infections, be sure to consult your doctor. If you experience burning, redness, or itching at the application site, let your doctor or pharmacist know. It's important to remember that your doctor prescribed this medication because they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects, but it's important to contact your doctor if you notice blistering, swelling, or oozing at the application site. While a severe allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist. Remember, it's important to always consult with your doctor before starting or stopping any medication. Before using Ciclopirox suspension, topical, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss your medical history with your doctor or pharmacist before using this medication. If you are planning to have surgery, be sure to inform your doctors or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is currently unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. As for the daily dosage and optimal timing, be sure to follow your doctor's instructions for using Ciclopirox suspension, topical. This medication is typically applied once or twice daily, as directed by your doctor. Be sure to use it regularly to get the most benefit from it. Remember to use it at the same time each day to help you remember. It's important to be aware of potential drug interactions when using Ciclopirox suspension, topical. It's best to keep a list of all the medications and products you use and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the effectiveness and safety of your treatment. Always consult with your healthcare provider before making any changes to your medication regimen. If this medication is ingested by mistake, it can be dangerous. If someone takes too much and experiences severe symptoms like fainting or difficulty breathing, it's important to call 911 immediately. Otherwise, you should contact a poison control center right away. In the US, you can call 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. Ciclopirox suspension, topical is used to treat certain types of fungal skin infections, such as athlete's foot, jock itch, and ringworm. It works by stopping the growth of fungus. This medication is for external use only. Apply a thin layer of the medication to the affected area and rub in gently. Use this medication as directed by your doctor, usually once or twice a day. It is best to use it at the same time each day. Follow the dosing schedule carefully and do not apply more or use it for a longer time than prescribed. Remember, it's important not to share this medication with anyone else. Your doctor has specifically prescribed it for your current skin condition, and it's not meant for use in any other skin infection unless directed by your doctor. In that case, a different medication may be needed. If you're using this medication to treat athlete's foot, be sure to wear well-fitting, ventilated shoes and change your socks at least once a day. This can help improve the effectiveness of the treatment. If you happen to forget a dose, go ahead and use it as soon as you remember. But if it's almost time for your next dose, just skip the one you missed and continue with your regular schedule. Don't take a double dose to make up for the missed one. Just stick to your usual routine. Keep the Ciclopirox suspension, topical, at room temperature. Store it away from children and pets. Do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for more information on how to dispose of it properly. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.